I've got good news. Maternal mortality and infant mortality rates have gone down in the last couple of decades. Hi, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And today I'll be talking about every newborn progress report. As you can guess, this has been actually out every year for the about last 6 years. And so this is actually a newborn progress report plan based on the progress that has been made. Now, even though I started off by saying that there has been a lot of progress made, a lot of reduction in maternal and child mortality and infant mortality, there's still a lot of work to be done. And if we do the right things, then as many as 3 million newborn deaths can be prevented. Again, as I said earlier, just specifically 3 decades, in the last 3 decades, we've made remarkable progress in child survival and newborn health in all regions of the world. It's not just high-income countries. So the global newborn mortality rate declined by more than half between 1990 and 2018. This was from 37 deaths per 1,000 down to 18 deaths per 1,000 live births. So is this not cause for celebration? Of course it is. But we can do better. The fact remains the risk of dying is highest in the time around birth and the first month of life. Something else that's a staggering number is that 3 million lives are lost due to newborns, stillbirths, and mothers. 3 million people lose their lives. So what the Every Newborn Action Plan says that these 3 million lives that are being lost by mothers, newborns, and stillbirths, this can be actually saved by universal coverage of quality maternal and newborn care. Now, looking at this Every Newborn Action Plan, this is set out of evidence-based solutions and a clear roadmap to 2030. So this is very recent. These are roadmaps to 2030. A couple goals, and then we go into milestones. So ENAP set out evidence-based solutions and a clear roadmap. Let's see what that roadmap is. So before we get into the roadmap, there's 2 goals. One is ending preventable newborn deaths by 2030, and then 2, ending preventable stillbirth by 2030. Right now, all countries, by 2030, all countries will have reached the target of 12 or fewer stillbirths per 1,000 total births, and then close equity gaps. How do we achieve this? Well, here are some milestones. Milestone number 1, ENAP set national milestones to 2020 that provide a roadmap for countries to drive progress to ensure quality, universal care for all mothers and their children. Again, milestone 1, if you go into detail, I'm not going to go into too much detail, but if you go into here, you'll see that if you sharpen national strategies, policies, and guidelines for reproductive, maternal, newborn, child, and adolescent health in line with the goals, targets, and indicators in ENAP, including a clear focus on care around the time of birth and on small or sick newborns, then this will allow for reduction in newborn mortality. For all 90 countries, 87% have completed a newborn action plan or updated the maternal newborn health component in their plan. 87% have defined newborn mortality reduction target, which is always a good sign. In the highest burden countries, of the 20 countries with the highest burden, 95% have developed plans and defined newborn mortality rates reduction targets. And also, of the 20 countries with the highest newborn mortality, 45% have developed newborn plans. There is work being done. That's what the good sign is. Let's look at milestone number 2. This is quality of care. Adopt standards of quality and indicators for assessing quality of maternal and newborn care at all levels of the health system, and ensure access to essential commodities for these adolescent health, reproductive, maternal, all of these, newborn. So again, for all 90 countries, this tells you what percentage, and 32% have an updated policy. This is the lowest one, on kangaroo mother care, most since 2014. So for those of you that may not know, kangaroo mother care simply means skin-to-skin contact after birth, and then breastfeeding almost exclusively. So only 32% increased on that. Of the 20 countries, the highest number of newborn deaths, 90% have adopted clear current developing guidelines. So now let's look at every newborn milestone 3. This is investment in health workforce. There's a lot of places where the physician to patient ratio is just so low, and that is actually physician-patient ratio. The physician-patient ratio is so low that there's not enough care to go around in the general population. So the important thing to do is, for all the 90 countries, 43% have reported, and this is not too high, 43% reported having a human resources plan or strategy for births to be attended by skilled health personnel. There's a shortage of skilled health personnel, and something urgently needs to be done. More than 43% needs to sign on. So let's look at the highest burden countries, and of course what they're doing. So across 5 aspects of maternal and child newborn health workforce strengthening, there's progress in those countries. Milestone number 4, community engagement, parents' voice, and champions. Involve communities, civil society, and other stakeholders to increase demand and ensure access to and coverage of essential maternal and newborn care. Parents' voices and champions shift social norms so that it is no longer acceptable for newborns to die needlessly, just as it has become unacceptable for women to die when giving birth. Then every newborn milestone number 5, simply data. Count every newborn by using and improving programmatic coverage data, including equity and quality gap assessments. Institutionalize civic registration and vital statistics. Adapt and use a minimum perinatal dataset. Implement maternal and perinatal data surveillance and response. Perinatal death surveillance and response. As you can see, one word does describe this milestone. Having enough data means you're conducting surveillance. Having enough surveillance means you can actually conduct sufficient prevention strategies. Here's some statistics that you could look over on your own, where the improvements are there. course, milestone number 6 goes without saying. Once you have the data, research and innovation is absolutely essential. 39% of countries have a prioritized research agenda, which is not too high. Develop, adapt, and promote access to devices and commodities as far as what innovation is comprised of. To improve access to devices, commodities to improve care for mothers and newborns around the time of birth, and agree on disseminating and investing in a prioritized and coordinated research agenda for improving preterm and newborn health outcomes. Particular focus is required for stillbirths, which are often left out of research agenda or left behind. So those were the 6 milestones that have been included part of the newborn, every newborn progress report, every newborn action plan. I hope this has given you an overview of how to decrease infant and maternal mortality rates. Thank you for listening.